We bought more vaccines. 2 weeks ago, I directed Jeff Zients, who's here with me, my COVID-19 response coordinator, to work with the Department of Health and Human Services to purchase more vaccines. Just this afternoon, we signed the final contracts for 100 million more Moderna and 100 million more Pfizer vaccines. We're also able to move up the delivery dates with an additional 200 million vaccines to the end of July, faster than we expected. And in further good news, both companies agreed, and we're now contractually obligated to expedite delivery of 100 million doses that were promised by the end of June to deliver them by the end of May.
After a slow start, the vaccine rollout in the US is now picking up speed. The White House medical advisor says vaccinations could be available without restrictions in the US by April, and that should see most Americans vaccinated by mid-September.
We have those priority 1A, 1B, 1C. If you look at the projection, I would imagine by the time we get to April, that will be what I would call, for better wording, open season. Namely, virtually everybody and anybody in any category could start to get vaccinated.
The US president says by the end of July, the country will have enough vaccines for 300 million Americans. Joe Biden says that is a big achievement, given there was no rollout plan under the previous administration.
While scientists did their job in discovering vaccines in record time, my predecessor, be very blunt about it, did not do his job in getting ready for the massive challenge of vaccinating hundreds of millions of Americans.
So far, more than 46 million vaccine doses have been injected and many more distributed, according to the US Centers for Disease Control and Prevention. CNN medical analyst and professor of medicine at George Washington University, Dr. Jonathan Reiner, is with us this hour from Washington, D.C. Dr. Reiner, it's good to see you. Thanks for being here.
Good to see you, John.
Okay, so in the medium term, less than 4 months away, it looks like it could be game on for vaccinations. That's according to Dr. Anthony Fauci. But right now, though, at this present point in time, there are still headlines like this one. Los Angeles closes 5 vaccine sites amid shortage. And according to this report, LA received just 16,000 doses of the vaccine. That's about a day's supply, but it was meant to last the entire week. Now, there's no real shortage nationwide, we're told. This was a distribution screw-up. So how much work is still needed to fix that part of the equation? And can it be done in the sort of time frame that Fauci is talking about?
Well, there's a lot of work to be done. You know, we think we need to vaccinate for herd immunity probably 250 million people. And we have delivered about 46 million doses to date. So there's a lot of work to do. And we're going to have to get much bigger. You know, we really have to get much more into mass vaccinations. Right now, the last week has been pretty good. We've vaccinated about 1.5 million people a day, but we're using 2-dose vaccine strategies. So at some point, we're going to be vaccinating every day about, half the number of patients. Half the number of people will be new vaccines, half will be second doses. Eventually, we'll have the 1-dose vaccine available, but we're going to probably have to do twice what we're doing currently to vaccinate the population by the end of the summer, which is the goal of the Biden administration. We have a lot of work to do.
It was hoped that by shipping the vaccine to pharmacies and grocery stores nationwide would speed this process up, but so far, still early days to be fair, but it's sort of been chaos and confusion caused by lack of coordination, overwhelming demand. What we're seeing in places like Britain with the National Health Service and Israel, which has had a national immunisation program for years, their rollout has been successful, relatively speaking. Does it say that eventually or ultimately, if this is going to happen, and if it's going to happen correctly and properly, the government just has to get involved really hands-on and make it work?
Right, and I think the Biden administration understands that, which is why they're getting the military involved, they're getting FEMA involved. Britain and Israel differ in really a big way from the United States in that they have essentially national health services. And the U.S. has these silos of healthcare throughout the country. So it's easier for countries like the UK and Israel to organize these mass events. They have really just a handful of information systems. They know where people are. The United States is much different, and we're learning on the fly, but we're getting better. The number of shots we're giving every day is increasing almost by the day. So I'm very encouraged by the trend.
Yeah, actually, as you say, the trend is looking to be in the right direction, which is good. Yeah. But until those vaccines become vaccinations, and there's these new, more contagious variants spreading, the health experts, government officials, all saying it's crucial to maintain social distancing, wash hands, wear a face mask. It seems the only thing better than wearing a mask is wearing two masks. Here's Dr. Fauci.
What the CDC is saying, that at minimum, wear a mask, okay? This is what they're saying. Make sure you wear a mask. So you wear a mask. Then you want it to fit better. So one of the ways you could do it, if you would like to, is put a cloth mask over, which actually here and here and here, where you could get leakage in, is much better contained.
Which is great, but just a month ago there was reporting like this from health.com. Very little scientific data points to any benefits or drawbacks of wearing more than one face mask. I know things change, but it's been hard enough getting people to wear a face mask in the first place. So what's your advice here?
I think Dr. Fauci's advice is good. My advice to people is to try and acquire either a KN95 or an N95 mask. Those masks, which fit pretty tightly around the face, are very effective at preventing transmission or acquisition of the virus. What this sort of double mask strategy does is to take a mask that doesn't fit quite so well and make it fit better. So I think if you can't get a KN95, then do exactly what Dr. Fauci has suggested. But it's really been a lost opportunity over the last several months. You would think that now, a year into the pandemic, the public would have had much easier access to more effective masks. When the history of this is written, this is going to be one of the most important failures in this country, not getting very effective masks out to the population early.
Yeah. One of the many failures, but yeah, that will be certainly up there. Professor Reiner, good to see you. Thank you.